We're following devastating new research on the coronavirus. Get this, 1 in 500 Americans have died from COVID since the beginning of the pandemic, and the elderly are among the most affected. We've learned 1 in 35 people over the age of 85 have died from the virus. The numbers are even worse for communities of color, mainly because of social inequities and health care access. And these alarming figures come as U.S. officials intensify their push to vaccinate more Americans. Nearly 64% of the population has received at least one dose. That's according to the CDC. But now researchers are looking into possible boosters. For more on this, let's bring in urgent care nurse practitioner Justin Gill. Justin, the FDA has released details of Pfizer's booster shot application, finding no major safety concerns. Meanwhile, Israel has published a new study supporting the short-term efficacy of third doses. What's the medical opinion, your medical opinion on boosters?
Well, it's great to join you both this morning. I think that there's a lot of news coming out when it comes to booster shots. I think some reassuring information coming from Israel indicating that booster shots do increase the overall efficacy of the vaccine against symptomatic disease, but also severe disease and risk for hospitalization. I think part of the concern here, at least from some members of the FDA advisory group, is whether or not boosters right now is the best option with the resources that are available. And I think that question it raises some valid concerns, right? So a significant number of people in this country are still completely unvaccinated, meaning they have not received both doses of their COVID-19 vaccine. So trying to logistically carry out a booster program while so many still have yet to get their first shot raises concerns about supply, the ability to deliver those vaccines, and still convincing people to get vaccinated. The booster shot data that we have available does show that it increases overall neutralizing antibody levels in people who have gotten the third shot, but it brings up the discussion about waning immunity, meaning immunity that's less effective from the second dose, but does still provide strong protection from severe disease or hospitalization.
So you are based in Washington. Washington has certainly seen sort of a spike in cases, but the governor there has implemented a vaccine mandate for thousands of employees. But many people have filed for exemptions. You know, what does this indicate about sort of the ongoing hesitancy when it comes to people's comfort level with the vaccine?
Yeah, it's an important question. I would say the broad majority of healthcare workers, near 90% for nurses, above 90% for physicians and other allied health professionals, are completely vaccinated. So I want to make sure that's clear that the overwhelming medical community, healthcare community, supports the science, data, and information that goes beyond or behind this vaccine. With the mask mandates, I think that there's a lot of concern about the politics of it, about being required to, say, wear a mask or requirement to get vaccinated. But what I tell people is that if you take the politics out of it, it's just common sense. Wearing masks is something that's been, helpful for us throughout this past year and a half for slowing down the spread of COVID-19. And we know for the past 6.5, 7, 8 months that the vaccine has been effective in slowing the transmission of COVID-19, preventing death and hospitalization from COVID-19. I think to my colleagues on the front line, think about the patients that you're serving. These patients look up to you as role models. They trust your voice as a nurse, as a physician, or a healthcare professional. So what you say to them or the example that you serve to them makes a huge difference in their decision to ultimately get vaccinated. I consider the trust that patients put into the work that I provide extremely privileged, as well as I'm humbled by it. And it's something where I have to make sure that the information I give to patients is backed up by action. And that action is getting vaccinated ourselves. We need to keep our workforce healthy. Our workforce is overrun. We are exhausted. Our volumes have significantly increased, and our hospitals are being stressed to the max. So we need to stay healthy, we need to stay working, and we need to be a positive role model for those individuals in our community so we can save more lives and save more people.
Some Louisiana nurses are threatening to quit after a major hospital system said it would require vaccinations. Hospitals nationwide, Justin, as you know, are understaffed. What are the consequences of vaccine refusal from healthcare workers?
I think there's some potential ones. You know, we have to look at the staffing situation in those hospitals, but I don't want to necessarily confuse the staffing issue with a certain percentage of nurses that may want to leave their positions because they don't necessarily want to get vaccinated. I would say in my discussions with nurses across the country that I know, much of the reason why nurses are leaving and why we have a shortage is not necessarily because nurses are not wanting to get vaccinated. It's more about the burnout, the stress of the job, the overwhelming burden that's placed on these health professionals when they go to work. You know, I think that the impact of the mandates can be different based on each region and locality. I think that each region and each government needs to, you know, negotiate with those specific groups in those specific regions and develop a timeline. But, you know, the message I'd give to my nursing colleagues on the front line is we've got to do this. This is part of our nursing practice. This is our ability to look at the evidence, look at the science, and also educate our patients about what is right. So I think that the ultimate answer for this is that those nurses should get vaccinated, and that, you know, saying that the vaccine may not be safe or that they have personal objections to the vaccine is helpful, you know, to explain their position. But at the same time, we have to look at the community. We have to look at the transmission rates. You have to look at the hospital admissions and the fact that other patients that have other medical conditions can't necessarily get care because beds are full with people that have COVID-19 overwhelmingly unvaccinated.
Justin, what if they say, look, I've worked a year and a half during this pandemic. I've given this thing my all. I didn't get COVID over the past year and a half. Why do I need to be vaccinated?
That's a great question, Anne-Marie, and I've heard it from many of my nursing colleagues, many of whom I worked with when I first started my career. And it's a difficult discussion to have with people that I consider my friends, people that I consider my colleagues on the front line. But ultimately, when I look at this, I have to call out what is the best option for the patients that I serve. I got into this work not to hurt people. I got into this work to help people. And just as I would call out my colleagues if, you know, they didn't wash their hands going in between rooms, or they were making a clinical error that they may not have identified, or they were, maliciously wanting to promote, I would call them out on that, because my role is, and my duty is to the patient. It's not necessarily to my fellow nurses. So, I think most nurses understand that. Most clinicians understand that we work in an environment where we hold each other accountable. Sometimes we do have disagreements, but if we're going to continue to work through this pandemic and see it through after these 1.5 years, it's not by avoiding the vaccine. It's by getting vaccinated and showing our patients, our family, our friends, the people that trust us outside of the hospital, that vaccines are safe, effective, and that you are willing to, get vaccinated so that you can show that it works and it's safe.
All right, Justin. Always great having you. Justin Gill, thank you.
Thank you.